welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now, in today's episode, I'd like to address a growing concern regarding the coronavirus and individuals with HIV. Now, it's understood that people with severe immunodeficiency are at greater risk, but it does not appear to be the case for HIV positive individuals who are on antiretroviral treatment and have a viral load that is undetectable and would also have an adequate CD4 count. Individuals with HIV are at a greater risk of getting sick from COVID-19 if they have a low CD4 cell count and a high viral load because they are not on an antiretroviral therapy program or have a recent opportunistic infection. Now, individuals with HIV are also at an increased risk of getting very sick if they are at a much older age or have a pre-existing condition such as chronic lung disease, cardiovascular disease, high blood pressure, or diabetes, and are smokers. HIV positive individuals may be more at risk of an adverse outcome relative to getting infected by the coronavirus for reasons that have little to do with their HIV status. Individuals with HIV generally have an immune system which may not be prepared to deal with being affected by the coronavirus because individuals living with HIV tend to be more vulnerable to respiratory infections when they are not properly managing their condition. Now, this is why it's very important to take your antiretroviral treatment as prescribed. Now, going untreated, HIV attacks the immune system, to be specific, the CD4 cells, which are very important for fighting off infections. Being on antiretrovirals help keep HIV in check to keep you healthy. A question in which I'm being asked more and more is, what can an individual living with HIV do to protect themselves from the coronavirus? I simply inform them that at present, there's no vaccine available for this virus. So the best way to prevent getting infected is to avoid exposure to this virus as much as possible. And if you have access to an acupuncturist, see them as well. Acupuncture works well in treating HIV in addition to therapy prescribed by your primary care physician. I also recommend to my patients who are living with HIV and are extremely concerned about the possibility of being infected by COVID-19 to continue to eat right, get at least 8 hours of sleep, and to reduce stress as much as possible. Another question I've been faced with is, what should you do if you feel you're experiencing symptoms of the coronavirus? I have one answer for that, and that is to contact your primary care physician right away. Now, I've been asked an interesting question recently. Now, this question was, as an acupuncturist, how do I view and diagnose HIV? You see, the etiology of HIV from an allopathic perspective is similar to the contraction of toxicity in traditional Chinese medicine. In Chinese medicine, too much unprotected sexual activity tends to exhaust kidney essence. Therefore, when an individual creates an instability of basal qi, this increases susceptibility to toxic pathogenic influences. Now, sharing hypodermic needles for recreational drug use is considered a toxin in traditional Chinese medicine as well. Now, toxins in Chinese medicine are drying and hot in nature, which depletes yin and fluids, leading to yin deficiency. These acquired toxins tend to hide deep within the body and are usually activated by various pathogens that the body's protective qi usually can easily fight off. The early and intermediate stages of HIV are differentiated based on the 4-level diagnosis in Chinese medicine. These levels are 1, the Wei level whereby the pathogen exists at the surface and can be easily discarded. 2 is a Qi level whereby the pathogen or the toxin in this case has gone from external to internal. And 3 is the Yin and nutritive level, and 4 is the blood level. Now, when it gets to this level, most times the outcome is not good. The overall strength of your righteous qi will determine the progression and prognosis of the pathogenic toxin. Now, basic patterns of HIV in Chinese medicine are febrile pathogens depriving the lung and stomach yin, qi sinking and heat accumulation in the stomach and intestines, phlegm heat misting the orifices and enlarging in the terminal yin, and separation and disconnection of yin and yang. Now, when it gets to this stage, I said the prognosis is not favorable. Now, a treatment principle is to support the righteous chi and to remove toxic pathogenic influences, because when the righteous chi is weak, toxic pathogens tend to linger, which constitutes the overall major pathogenesis. Now, my treatment protocol with the use of herbs and acupuncture, I would focus on nourishing the yin, clear heat, moisten the lung in the case of febrile pathogens depriving lung and stomach yin. Now, when it comes to sinking and heat accumulation in the stomach and intestines, I would benefit the chi and lift the yang, eliminate dampness, and relieve toxicity. Now, for phlegm heat misting the orifices and lodging in the terminal yin, I would clear the heart and open the orifice, cool the liver, and prohibit the wind. Now, when it comes to the most severe stage, which is the separation and disconnection of yin and yang, I would attempt to restore the devastated yang, restrain the yin, warm the kidney, bind the intestines, tonify chi, and lift the collapse. I know some of you guys are like, what? This is why I recommend you subscribe to my channel, because to have seen many of these episodes to this point, you would have a clear understanding as to how all of this works. So go ahead and hit that subscribe button. And until next time, acupuncture is my life. What's yours?